Assalamu alaikum and welcome to a brand new episode of Mental Health Matters with me, your host Maryam Hilli, and joining me as always is our very own mental health professional Anisa Diab, also my co-host. Welcome to the show, Sister Anisa.
Thank you for having me. It's an honor to be here.
Thank you so much. Sister Anisa, today we're discussing postpartum depression, and joining us is a special guest who completed her Doctor of Medicine in Bethesda, if I'm saying that correctly, which is in Maryland at the USU, the Uniformed Services University, where she went on to do her residency training in general pediatrics at Walter Reed Medical Center in Bethesda, Maryland. She has practiced full spectrum pediatrics, caring for newborns through college-age students for over a decade. During her career, she has had the opportunity to mentor physicians in training as well as mid-level practitioners through their pediatric rotations. She currently practices as the medical director of a federally qualified health clinic which services children and adolescents who are uninsured or underinsured in Orange County. As a mother of two, wife and a holistic pediatrician, she strives to support children and families to live the healthiest lives. She has particular interest in caring for infants, women and caregivers during the first 12 weeks after a new infant's birth, also known as the fourth trimester. Welcome to the show, Sister Laela Mohseni.
Thank you so much. Thank you for having me.
Thank you. Sorry for the long-winded introduction. I hope that was okay. Sister Laela, thank you again for joining us. I want to jump straight into our topic about postpartum depression and ask you, what are the common mental health challenges that are faced by new or even seasoned mothers after delivery?
Perfect. Yeah, I think the biggest thing, really, honestly, that I see is really each pregnancy, gestation, delivery, postpartum period it's unique, and being able to accept that some things will be out of your control. Persons of faith can rely on we can rely on our faith to say there will be some level out of our control, because truly it is an experience. There can be good things, there can be bad things, but really owning that it is each time it can be your first pregnancy and delivery, it could be your 10th. Each time is very unique. Some of the challenges that I see as a pediatrician, because I oftentimes people might say, that are watching the show, why is the pediatrician on here? After the new human is born, the infant, the pediatrician is seeing the couple, the dyad is what we call it in the medical community, the mother and the infant, and often whoever the caregivers are, the supports, whether that be the husband or grandparent. We are seeing that dyad, that unit, more often those first 2 months than anyone typically. We see the baby 2 days after they're discharged. I personally see them for a weight check at 2 weeks, 1 month, and 2 months. So just in those first 2 months of life, I'm seeing the baby, the mom, and a caregiver 4 times at minimum. That's assuming everything's going perfectly. Okay. So though, that's the one big point I'd like to bring up. Things that, I see we're going to talk a little bit more about in the show, but, baby blues, we'll talk about a little bit more about postpartum depression, postpartum anxiety. That birth experience alone can lead to anxiety, can trigger some good or bad memories and lead to postpartum, further postpartum depression and potentially PTSD even. Okay. So those are kind of the big things that I see with new, or like, again, moms that this is their 10th baby.
Thank you so much for that. And Sister Anisa, what are the various postpartum mood disorders and their prevalence?
So as Dr. Laela was talking about, she mentioned postpartum depression, and it's really complex. It's a mix of behavioral, emotional, physical changes that happen to women post-delivery. And it's typically a major form of depression that begins about 4 weeks after delivery. And it affects about 15 to 20% of new mothers. So, the actual link between the depression and the chemical changes isn't very clear, but we know that there's a lot of hormonal changes after delivery. And these, the chemical changes can bring on depression, even for somebody who has never experienced it before. It can also be related to social, psychological changes, and that can all create an increased risk of depression too. And there's also postpartum anxiety. This is where a person, new mom will have racing thoughts, might be losing their appetite, have physical tension going on, and just constant worry about the future. And so sometimes even these moms who are experiencing postpartum anxiety will have panic attacks, you know, and that can be part of a panic disorder as well. And this affects about 6% of pregnant women and 10% of new moms. And then, you know, although this is very, very rare, there's postpartum psychosis as well. And this, you know, again, it's rare, but it affects 1 to 2 new moms out of 1,000 deliveries. And it can come on very suddenly. It can involve having delusions, having rapid mood swings, difficulty communicating, just hallucinations, paranoia. And if somebody has had a family history of bipolar disorder or a previous psychotic episode, this can also make them, you know, more at risk for developing this. But it's really critical for somebody in that situation to get immediate help, to go to emergency room, because when a mom is not in touch with reality, there's obviously risk for harm to oneself or even one's child.
Thank you, Sister Anisa. And Dr. Laela, we often hear about the baby blues. Are they the same thing as postpartum depression? Are they different? Can you just tell us a bit about each?
Sure, yeah. So kind of rolling over what Sister Anisa was just speaking about. So baby blues, a lot of parents, I even say fathers can experience them too. We're focusing on the mother today, but the father can experience some of these symptoms as well. Baby blues, it versus the postpartum depression, the main difference is the length of time typically. So baby blues is you're going to start feeling some of these symptoms within 2 to 3 days. So typically in the United States, it's typical practice, and I'm sure, I believe in the UK as well for my UK counterparts, but it is typical practice to leave the hospital after delivery of a first baby after about 48 hours for first-time families. If you're a seasoned parent and everything went splendidly, no complications, you may leave the hospital as early as 24 hours. And during pandemic, it has been known to some of those families leave even sooner than that. And so the baby blues period typically will start around that 2 to 3 day period. So that's that time when you're at the house by yourself with this infant. The infant is waking up now to feed more often because there's a 24-hour period where they're kind of sleepier. And so, you know, all of these changes, these hormonal changes are really setting in, these body changes. But typically the thing with baby blues is it's going to go away by 2 to 3 weeks. So 2 to 3 days to 2 to 3 weeks. Postpartum depression, as Sister Anisa kind of hinted at, is anything that's persistent beyond 4 to 6 weeks. And depending on which definition you look at, which legislature, the American Academy of Psychiatry, the WHO defines it as symptoms up to 12 months. And depending on what academic paper you're reading, some define up to that postpartum depression, the presentation being up to 12 months after the delivery of the live born infant.
Thank you. And Sister Anisa, for mothers who are struggling with motherhood and having suicidal thoughts, what advice would you have to offer to them?
First of all, this is definitely not uncommon for new moms, even seasoned mothers who are having a second, third, fourth child, whatever you might have it, to have, you know, these thoughts in the back of their minds. And when we're talking about any kind of depression, you know, as clinicians, we always assess for suicidality and where a person is at with that. And, you know, there's definitely a difference between passive suicidal ideation, where, you know, somebody is having the thoughts, but they don't want to act on it, versus somebody who has active suicidal ideation, where they're having the thoughts and they have an intent, they have a plan, they have the means, and, you know, there's an imminency to acting on the thoughts. So, you know, those situations are treated a little bit differently, but both situations do merit getting support, reaching out to a professional. And, you know, untreated postpartum depression can be very dangerous, not only for the mom, but for the children as well. So if, you know, the new mom is feeling like they can't function normally, they can't cope with everyday situations, or they're like having thoughts of harming themselves, harming their child, if they're extremely anxious, panicked, scared throughout the day, you know, that's a sign to really reach out. And having these thoughts does not make you a bad parent. I just want to emphasize that. And, I think there's a lot of barriers for moms to reach out when they're having these thoughts. They worry about, for instance, what will happen if they ask, and is it, as women, especially, I think we are perceived as needing to be strong for kids, needing to be the one to take care, and there's embarrassment to need help. And some moms may worry, for instance, that if they report that they're having these thoughts, their children, their baby will be taken away. And so I think there's a lot of misconceptions out there about what's going to happen when you have these conversations with your OBGYN or your primary care physician or your mental health counselor. And it's really important that you have these conversations, that you share your thoughts. You can always ask in hypotheticals too. If you're uncomfortable about disclosing right then and there, you can say, if a mother were to be having thoughts of harming themselves or harming their child, what would be the steps that are taken? And then to say, I believe that I'm experiencing those things. And it's really important to find a doctor who's going to take these things seriously, and to be an advocate for you and getting you the proper treatment and support, because, there definitely is a lot of treatment options out there for moms who are experiencing this kind of, depression and suicidal ideation.
Sister Laela, or Dr. Laela, as I should call you, what would you say to pregnant women who are fearful of taking medicine, particularly if it's medicine that they need for mental health?
Yeah, so definitely, especially if you're noticing the signs in pregnancy, the big thing is have that discussion, right? Have that open dialogue with your midwife, your obstetrician, whoever is caring for you at that time. Recognizing during pregnancy actually is great, and that's actually a strength that I've heard Sister Anisa say this before, but yourself, have that good relationship with yourself, your partner. If they're saying things, if those people around you are saying things, it's hard sometimes to not take things so sensitively, but those might be the signs. And those around you love you and care about you, but yourself, right? So having that open dialogue, I think right now, medicine's at a, depending on where you practice, we're in a different situation right now. It used to be a patriarchal system, right? Where meaning that, whatever the doctor said, you followed, and that was it. There was no questions asked. In the era that I've grown up in, and it continues to unfold even through pandemic, it really is that open dialogue. If you don't have a provider that you can be honest with, that you feel like you're kind of telling little white lies to, like just to get them not to answer, to move on to the next subject, that might be not the best fit for you. With your that goes, mental health counselor, your obstetrician, your pediatrician. I have I have friends tell me like, hey, my pediatrician didn't really listen to me. I'm like, well, you might need to look for, there's plenty of us out there. It's not always the right fit. Or just go back to that person and say, hey, I was a little bit dishonest, or I didn't like the way this discussion about my mental health went, or like, hey, I really am still having these feelings, but can we talk about medications? But I don't quite want to start it yet, but can we have this open dialogue? Another big concept with friends, family members, and my patients is to know that, this time is actually finite, and to enjoy it, right? It's a beautiful experience that Allah subhanahu wa ta'ala has given us. The ability, women are the ones that are chosen to carry the human, right? To go through gestation, our bodies are meant to deliver the human, and then later on potentially be used to help feed the human. And so trying to enjoy each one of those and be your best version of you during pregnancy, after pregnancy, you as a new mom, and having those open discussions. The other, and the time is, that time is finite. One day you're pregnant and one day you're not. And just because you start medications does not mean that it will be forever, for the rest of your life. If you're 26 and you're like, oh my gosh, if I start meds now, am I going to be on these until I'm 80? No, not necessarily. A lot of times I see moms, and I don't prescribe medications to the pregnant mother, but I have these open conversations, right? When I see them in the postpartum period, or if I'm meeting you for a prenatal visit, if there's any red flags coming up. So just knowing that the time of gestation is finite, these moods, the changes in the hormones are are changing, and the situation itself is finite. So really, really trying to enjoy it, be the best version of you, and sometimes that may include medications. It doesn't mean the very first time you use the word medication, or your doctor uses, or your obstetrician, or even your mental health counselor, the first time they use the word medications, does not mean that that's prescribing, and it's not committing you to a lifelong sentence, or lifelong use of these medications. There's plenty of medications that have been around. There's specific classes that typically we start with either during pregnancy or postpartum period, as they have a safer side effect profile for pregnancy and lactation. But there's plenty of options out there. So,
what are some of the challenges that you've experienced as new mums, and how did you cope with those concerns? And if I go to you first, Anisa.
I think for me, the biggest challenge, especially when I was a first-time mom, was the vulnerability that you feel. I mean, they hand you this human being that you don't have any experience, especially as a first-time mom, taking care of. You've never been through the other end of caring for a human and seeing them coming through those stages. So you question, your abilities, you question whether you're going to be able to handle all this. And I think a lot of times you don't realize how hard it is, right? Until, the day comes. But I also remember experiencing so much joy at the same time. So it was very confusing, I think, emotionally, because you feel like, you've been handed like the sun, the moon, the stars in your arms, like the most precious, beautiful gift from Allah. But then there's like this huge worry that you have about, helping this baby thrive. So I think for me, and Dr. Laela, she alluded to this earlier, is to recognize, like she said, that this time is finite, and I think as a mom, there are just seasons of life that are very hard. And for me, it has always been the first 2 years of my child's life. I found, those years from, newborn age to 2 are just the hardest. And sometimes you just are trying your best to be mindful and in the moment and enjoy it, and recognize that, this isn't going to be this way forever. It might feel like you're just surviving hour to hour, but for me, it helped to just take things one day at a time, sometimes 1 hour at a time, and remind myself this isn't going to be this way forever. It's going to get easier. Eventually, this child will not need so much attention. And I think what also has helped me is to be very selective about where I put my energy, and not to drain my energy on unnecessary things or get pulled into other people's drama, but just to make sure I'm focused on using that energy to take care of my kid, take care of myself, and nourish that time and that journey between not only you and your child, but you're connected to your creator too, as you serve your child more and more. So that's what helped me.
What about you, Dr. Laela?
I appreciate everything Sister Anisa just said. And, I would say especially with my firstborn, I think all of us have our firstborn experiences, right? And, but again, any of these experiences, and it can be so different each time. But my firstborn, at that point was working in inpatient nursery. I worked pretty much up until the delivery. Physicians in general, we work too much, but in the US and in the UK, I'm sure. But I think because I went in there a little bit more confident probably than I needed to be. I had helped at that point because I was doing over half of my work at that time was inpatient nursery, helping moms, seeing brand new babies, helping the moms latch, getting dads involved. So I was like, oh, I've got this. I got that part. My biggest, my fears and my anxiety were coming out of just getting through that gestation, getting through a successful pregnancy. Each week was a celebration for me. I wrote my firstborn's due date was all over the wall. I had it plastered. This is her due date. She's coming on this day. I would talk to her and tell her that. And part of it was because our staffing model at the hospital, if she had come early, I knew my staff would have suffered. So I was partially thinking about, care of our patients. So that was really, when I got through you will hear people talk about birth wishes or birth plan. I had my support persons picked out, and really just getting through that feat of delivering this baby, pretty much not to every single thing that I had lined out, but almost everything I had lined out for my birth wishes with my firstborn was like, oh my gosh, it felt like a huge accomplishment. As a physician, as a female physician, being able to carry my infant to term gestationally was actually, it seems silly, but not having my baby end up in a NICU, not developing preeclampsia, all those other things were like a success for me. And so I was really trying to celebrate those things. And then when the human came out, this whole, like as Sister Anisa said, you're handed this human, all these emotions, we're doing prayers, we're so excited. And then here comes, well, this is happening by my obstetrician. I need to take care of this on your body. And then the child needs to eat. So now I've helped hundreds of women at this point, and now I need to help my human get milk. And immediately, like, she had this click, her head vibrated. It was something I had never felt. I had laid hands on over 200 kids at this point in this period. So trying to remain calm, be in the moment, like, okay, what is this? We went on, 5 other colleagues looked at this child, including lactation specialists, pediatricians, had never seen this before. And so me trying to figure out, hey, I thought I had this. I wasn't really emotionally, mentally prepared for having any type of feeding with difficulty, because I had helped so many moms, but getting the latch down, successfully, feeding my infant, which as a pediatrician, as a Muslim woman, was very important to me. I really wanted that as my postpartum experience, to be able to feed my human exclusively breast milk. But finding my new village, I would say, was one of the things that I knew people in different aspects of medicine, obviously, but really finding your support village of like people that will be there, that if you need to talk to them at different hours of the day, if you're having a really hard time on the weekend, who can you call? We went on to go home after the 48-hour period, and little did we know that there was a natural disaster coming. Literally, we thought it was going to not hit our city, but within 12 to 18 hours of being home with this brand new baby, having my own pain issues with postpartum healing, and then this issue with the latching, we lost electricity, we lost access to clean water. We were not able to get out of our neighborhood because of trees that were down. So we literally had a natural disaster within 24 hours of bringing our firstborn home. And so, we immediately looked to create a village. A couple of streets over, somebody had electricity. We took, our halal meat over there. They were non-Muslim, but they offered their freezer space. They offered space for my husband to cook, clean water, a place to take a shower. That, quite literally, I was in a first world country, but felt that I was in an austere environment. And so really that concept of village, I look at my patients now in the face, because sometimes I don't know if they really consider the physician, the MD, on their team. And I look at my moms, especially the ones, and dads, the ones that I feel like are having some of these signs or symptoms. I look at them in the face. I make sure to make eye contact, even behind the mask. I am part of your village. If my lactation consultant's in the room, we are part of your village. You can come talk to us, here's your resources. So I think really learning to create that village, and not feel so, it's hard not to feel isolated. But even as a pediatrician practicing in the hospital that I had practiced in, having access to physicians, lactation consultants, I still felt like that sense of village wasn't quite placed as well as maybe I could have ahead of time. But my husband and I quickly learned, we really had to find that support system. And even like my daughter ended up having a procedure about when she was 4 weeks old to release her tongue to help her latch. The lactation consultants that knew what I was going through, they purchased halal meat, made a meal, brought it to our house, kept the receipt, showed me that it was halal meat, so that I didn't have any reason to not trust them. But that was like part of the village. And one of the comments of the lactation consultant, I worked with her the least out of the 5 in our hospital, she said, she made a statement alluding to like the village that surrounded her when her husband passed away. And so that concept of village, having those people you can really rely on, I would say, and it may change. When you are in your lowest of your lows, you will really find out who those village folks are. So.
Thank you so much, both of you, for sharing your experiences with us. I'm definitely going to remember the concept of the village. But Sister Dr. Laela, if I come back to you and just ask you, as a pediatrician, what are the most common issues that you're seeing with women who are postpartum?
Yeah, I think, Sister Anisa alluded to this, the way that maternal instinct of whether, again, it's baby 1 or baby 10, is that super mom concept, right? That pressure that we put on ourselves as new parents and new moms. I've seen it in dads too. Not, again, we're focusing on moms, but that the other caregivers too, trying to do too, we joke around and I say, you're doing too much, DTMing, you're doing too much, literally. You need to, when that baby's falling asleep, even if it's in the middle of the day, especially those first 2 months, you need to go to sleep. And it's okay. You're not a bum mom, but you need to get your rest. The hormones change when you sleep. Your milk supply goes up when you sleep. These are all really important things. So just that concept of not being super mom. Sleep deprivation is probably one of the number one things I'm seeing with moms and dads, just the caregivers in general. So really I encourage them, especially if the baby's going through maybe a colicky period, the baby, if with the moms, I look at them, I'm like, if you've fed them, it's okay for you to hand the baby off. Do not feel guilty. Hand the baby off. Someone else can comfort the baby. There needs to be absolute clear lines and boundaries. And I think Sister Anisa is going to get into that about as far as feeding, because that can be a big pressure too. It's a big weight to have on your shoulders to feel like you are solely responsible for the nourishment of this infant. I support moms however they decide to feed their baby, whether it be through human milk, formula, or combination of the two. But I want to make sure that we're on the same page, and if we need to have the discussion either way, it goes, ensuring that we support the mom in what her decision is, as long as everything remains safe, right, for the baby. And in 99% of the cases, we can support that desire to continue to offer human milk. And so really just making sure people are on the same page. So being ability to speak up for what she feels is right for her child, and not trying not to doubt herself. You're going to have opinions from, that neighbor down the street, Aunt Susie, who you haven't talked to, or, Uncle Yusuf, like you haven't talked to in months. Even Uncle Yusuf is going to come give some parenting advice. You're like, whoa, haven't heard from you in a minute. So really just owning that you, at the end of the day, and I tell parents this, I tell moms and dads this every day, your child better than anybody. From the moment you have taken your child home, you have been with your child more than anyone on this earth. And so really respecting and knowing, feeling that confidence, asking the questions and being open to question or feedback from your providers, obviously, but really having, again, those candid conversations. The social isolation is another big piece, even pre-pandemic. Social isolation in the postpartum period is very common. Pandemic has only amplified that. So again, that concept of creating that village. And now there's the blessing of, pandemic. Again, I mean, we're in this forum right now, we're in 2 different continents, and even Sister Anisa and I are, we're in 3 different time zones here, and being able to do this interview. So the social isolation piece, that's one of the blessings that has come out of pandemic, right? And even within the Muslim community, our ability to connect with each other. And that, has continued in the social media platform for women in postpartum support groups. Even in your own profession or your neighborhood, there may be a first-time mommies group, right? And the specific area that you're in online, there may be, for me, it was, again, a physician's mom group socially that I found. So really that social isolation can be very detrimental to some of these mental health conditions, but making sure that you reach out and have that some level of regular socialization, even if it is through virtual forum.
You've already mentioned quite a few, but what other postpartum care for women do you recommend, particularly to prevent mood-related disorders?
I think, we've talked about it and already but recognizing those signs of the percentages that Sister Anisa talked about of the women that will go on to develop postpartum depression, up to 50% will begin just having symptoms during pregnancy, so during gestation. And that's, again, why having those candid discussions, hey, I'm not feeling great. You will get screening. It is standard of care to screen the mom at, I believe, most of their obstetrics or midwife visits for postpartum depression. But if you get into the mode, you're just going to answer, in the United States, we typically use something called the Edinburgh Postpartum Depression Scale. They use it during gestation as well. It's 10 questions. If you just get used to, answering, you're just going to answer it willy-nilly, and maybe not even take thought into the questions. And so it maybe artificially look normal. But deep down, you're already starting to feel those preoccupation, increased anxiety, aside from like the discomforts of the physical space that the human takes up in your body. But, if you're if your pain's well controlled and you're still not able to sleep, if you're worrying, if you might have thoughts of hurting yourself, or that life would be better off without you, or that you don't want to continue this pregnancy. And those are, again, recognizing those signs, getting help early is very, very important. Again, I go back to that dimension because I've heard Sister Anisa say it on different forums, is like knowing yourself, right? Having that relationship with yourself, not neglecting those different dimensions in life that are so crucial for you and your health. Silly things like eating, drinking, praying. That seems silly, but doing your prayers on time if you can, right? And just having that connection and again, that brings in kind of like that gratitude, like I'm thankful to be able to be healthy enough to carry this human, right? And to be going through this process. And ultimately, again, being the best version of you. Maintaining that spiritual dimension, I think, is very, very important. In the postpartum, I mean, even the pregnancy period, but postpartum, when I'm seeing moms, typically I say, go outside. The connection with nature is very important. Even if it's wintertime, if depending on the region of the world you live in, going outside for 15 minutes a day, doing your best to do it during sunlight hours. If you're able to expose yourself a little bit more to sunlight, 15 minutes of sunlight during the hours of 10 a.m. and 2 p.m. can help with vitamin D absorption, can help some of that mood stuff, can help with your circadian rhythm, even though it's going to seem like it's so off from the sleep issues, the sleep experiences that you have with a newborn. And then being okay with accepting help. If someone says, hey, I want to bring you a meal, hey, you know what? You should take the meal. As long as they can abide by your dietary restrictions, Muslim or non-Muslim. We had my second baby was a different experience, but people offered, and I think after we came home from the hospital for 10 days straight, someone was bringing us food. And so that was a gift. I was like, I'd rather this than pack of diapers, honestly, just because we were physically away from my family and with both my deliveries and my husband's family. And so just knowing that going into the second one, but not being afraid. If someone offers, hey, I'll take Sarah out with, if your child's older, your 5-year-old, and go for a play date with another child, let that be and be okay with that, as long as you trust the family, obviously. But being okay with accepting help, I think, is another big concept I talk to moms about, and dads.
Thank you. And Sister Anisa, if I can come to you, we know that mothers often get a lot of external pressure, when it comes to like raising their children, but what suggestions do you have for women who are experiencing pressures, particularly from in-laws, in terms of raising their children?
I love this question because I see it a lot with the clients that I work with, especially those who are either newlywed or about to become new parents. And I just want to say, like, Dr. Laela was talking about, having this village is so incredibly important. It's such a nama to live around in-laws, to live around family and supports that can be a part of raising your child, because nobody can do it alone. It takes a village. At the same time, it can be really difficult when you're dealing with those who may be very opinionated and have strong opinions about how you should raise your child, what you should do. And I think that what's key in before you become a new parent, but also as you become a new parent, this has to be revisited, is making sure that you and your spouse are really a united front, and everybody is going to have an opinion about how to raise your child, what you should do. But it creates a lot of confusion in children as they grow up, when they are looking to an authority figure, but one person is telling them one thing, another one's telling them something else. So I think it's important for both a husband and wife to be able to accept influence from one another, and to be able to resolve their issues, to try to be on the same page as much as possible before really taking in information, or at least if new information comes in, to be able to share with each other. I heard such and such about how we should take care of baby Amira. I mean, like, what do you think about that? Having conversations between each other, and not just saying, oh, well, my mom was a mom of 10 kids, so she knows best, so I think we should do it the way my mom did it, right? This is not going to fly well in a marriage. So I think you have to be cognizant of that. You have to be diplomatic and tactful. We have to obviously respect our elders, respect their wisdom and their advice, but that doesn't mean that they become a pseudo parent for your child. You are still the parent at the end of the day. The mother is still, you know, the primary mother, and has to be given respect as well in terms of how they want to raise their children, and autonomy in that. So it can be a very challenging area to navigate, but it requires discussion with the spouse and a lot of boundary setting in a respectful way.
And Dr. Laela, if I can come to you, can you share with our viewers how you think that spouses can be supportive of their wives during pregnancy, during the delivery, and also after when, as they become new mums?
Yes, this is a great question because the woman is the one experiencing, they, you know, almost immediately we almost know right the moment that we're pregnant, like you get vertigo, you feel nauseous, whatever, you feel some level of connection. Your husband on the other end, your spouse, your partner is like, oh, you still look normal, you know, especially with first pregnancy, it can be well into the second trimester before you can even see physical changes. You're still sometimes still wearing your pre-pregnancy clothing into the second trimester. So sometimes it can be really hard for the dads to connect, right? I really encourage, and I don't always get the opportunity with my patients to, especially if it's firstborns, to encourage the fathers to be present, really be present if possible, even if it's just virtually, right? Be present at those exam visits that mom's going to, that your wife is going to. You know, big things like the anatomy scan, if you can go to that, or again, just be one of the blessings coming out of pandemic is that, you know, we are using our virtual media more, or virtual platforms. So if you can Zoom in, if you can FaceTime in and just be there to experience that together, you know, as much as you can physically together, but if not, you know, even just being on the phone, like say the connection, whatever, to the video is not working, just be there on the phone, hear what the doctor says, you being part of that, that is part of you and that connection with your spouse, right? That's the whole reason why Allah has given you the opportunity. God has given you the opportunity to create this little human that's being, you know, baked inside of mama. And so really making sure that they can physically be present there. Depending on what the woman is experiencing, you know, I began with both of my children. I had pretty extreme nausea, vomiting, was not able to really get in the kitchen much, let alone be around like meat or prepared foods. So my husband really had to step into the role in the kitchen significantly during, I mean, to the point of like I would, you know, not even be able to come in the house and smell it. We were eating outside with my first pregnancy most of the time. So really stepping into that role of preparing the meals, especially if mom's sick, or even if she doesn't have experienced the postpartum, the first trimester nausea, second trimester nausea and vomiting, but like the fatigue, the level of fatigue, I think is really, a lot of women experience that. So just, you know, doing those extra things, to ensure that she gets maybe even 30 extra minutes of sleep, or if you notice, seen fathers step in and say like, hey, I think we should get a different pillow, or, you know, just to help with that sleep, because the restorative sleep is so important. And then, so that's kind of like during the pregnancy what I encourage, but also being present there afterward, for the time of the delivery, making sure again that you both are on the same page. The wife is going to be the one delivering the baby, but guess what? Something may happen to her where she is in extreme pain. She has difficulty articulating what her wishes are. And so again, it's super important. You are going to be that second person in the room, most likely. During pandemic, when they only let like one other person in the room, sometimes here in the United States, depending on where we were practicing regionally in New York City, they weren't letting anyone in the room except for, your partner was there virtually. And so really having a clear explanation of like, hey, honey, this is what I think. What do you think? You know, if this, then this, as much as you can. But again, knowing that everything's not in your control. But if you vocalize like, hey, if I do have to go to a cesarean, and dad's allowed in the room, I want dad to be in the room and be there to hold the baby. I would, you know, I really want minimal interventions for whatever X, Y, and Z. I want to make sure I'm breastfeeding my baby by, you know, this time. And so just those things, making sure dad should feel empowered, that he understands he can help carry out the wishes of his wife and them together as a team. And then for the new mom, just bringing water. You men don't have the anatomy to breastfeed, but I always look at a dad and I say, hey, you can get the baby prepared. You know, it's time to feed. go ahead, get the, or, you know, it's been more than 2.5 hours, especially in that newborn period. I say, don't let the baby go past 3 hours. Dad, you go ahead, get the baby, change the diaper, wake the baby up, get the baby prepared while mom gets up, uses the restroom. Maybe she gets a drink to hydrate. So getting the baby prepared for the breastfeeding experience, the dad can be involved in that. Because sometimes I have seen dads feel like they feel like the alien in the room. And I really, you know, during the delivery process, I really, that does hurt my heart to see that, like, the dad's not involved. And so if I get called to a delivery as the pediatrician because something's going on, you know, I try to, you know, nudge the nurse, one of the nurses in the room, to kind of have dad come over, have him get involved. I look at the dad, give the dad eye contact, and the mom eye contact. So really making sure that they feel like they're part of it. Diapering the baby obviously is a big hand, always a help. But just those nourishment things for your wife as much as you can, and your baby, getting your baby ready.
Sister Anisa, if I can come to you, a lot of mothers experience challenges, particularly when it comes to breastfeeding after delivery. And this can be a great deal of distress for them. What are some steps that mothers can take to make this transition easier?
Absolutely. It can be very distressing because I think, especially as new moms, sometimes mothers think that they should just have the instincts in place to be able to do what they need to do. And breastfeeding is natural, it's instinctual, but the reality is you have to also educate yourself about the process. And I remember with my first daughter, I didn't have any, alhamdulillah, like very little, if any, breastfeeding issues. But with my son, just, you know, over a year ago, I had issues with him having tongue ties and not being able to latch. And he had to have a procedure to get that removed so that he could latch properly. And so, you know, nobody tells you these things, right? You have to be somebody who educates yourself and really tries to find out these answers. So I recommend, you know, before you have your child, take a breastfeeding class, make sure that you are joining different nursing support groups, identify a lactation specialist, somebody that you can go to if you need to have questions answered. Don't wait until you're struggling in the midst of that. And I know, mashallah, Dr. Laela, you know, she is a holistic practitioner as well who helps women with lactation issues. So, you know, reach out to somebody like that at the first sign of trouble. You know, don't let it get worse and feel like you have to throw in the towel if that's something that you really want to do, to be able to provide that nourishment in that capacity.
For some mothers, the birthing process can be painful and traumatic, leading to chronic pain issues and chronic anxiety or PTSD. Dr. Laela, how can mothers heal from this experience?
So I think, again, identifying it and getting help early on. Again, if you know if you're in an at-risk group, like if you had a like emergency or crash C-section is what we call it. If you have maternal infant separation, like your baby has to go to the ICU, you have to go to the ICU. If you have a past history of sexual trauma or some type of physical trauma, you're at a little bit higher risk for developing things on that anxiety and postpartum depression. If you have the perceived perception of that you're going to be losing control, because that can be amplified during pregnancy and delivery because you are very vulnerable, you have a little bit higher risk of going on to develop a little bit more of that anxiety, and then or that spectrum of postpartum post-traumatic stress disorder, especially if you experience near death, if you watched your child get chest compressions, if you know, the baby left and you woke up and you didn't know where the baby was at because you were put out. So really following up with it, if you're recognizing that you're having those nightmares, you're reliving that experience over, and it's so traumatic and it's affecting your ability to really bond, those are signs. Verbalize them. Talk with your partner. Talk with your provider. Okay. Pelvic floor health. We get embarrassed, just like our mental health. Pelvic floor health, pain, and the postpartum pelvic floor sexual dysfunction. Those are all normal. We don't talk about them. A lot of people don't talk about them. Muslims especially don't talk about them, right? But normalizing, those are all normal. Talking to your provider. Getting yourself help, whether it be mental, emotional, or physical health through different therapies. There's a whole section of medicine dedicated just to pelvic floor issues and women's health. And so educating yourself, talking to your doctor, or asking your doctor to find more information about it if you're not getting the answers.
Thank you. And Anisa, if I come to you for this question, what ways can new parents maintain a strong connection and relationship with each other as a couple?
It's important to realize this is hard for both of you as parents. I think, as mothers, yes, there's a lot of challenges, especially with certain things that maybe their spouse can't take on, such as nursing and things of that nature. But I think we need to recognize it's a challenge for both, because the whole dynamic of the family is shifting, the whole routine, the whole lifestyle is shifting. And I think what I see women struggle with is a lot of just anger, a lot of fatigue from sleep deprivation, and maybe saying things that maybe they didn't mean to say, or and the husband can do that too, vice versa. Maybe it was his turn to really look after the kids, at the baby at night, or the other sibling, and the next day when you're sleep deprived, you often say things you don't mean in those moments. So I think that a lot of times I hear women talk about how they feel it's unfair, how they get more of the brunt of the work, or it's like, why doesn't he just do this? Why can't he do that? But I think it's important that instead of just kind of offloading on each other and saying, hey, how come you don't help, or getting really angry and frustrated, that you let each other know when you've reached your emotional limits, and to say, listen, I'm really overwhelmed right now. I'm exhausted. I just feel like I can't even function. It would really help me out if you could unload the dishwasher. It would really help me out if you could do A, B, and C, rather than just reacting so angrily. Obviously, somebody's not going to want to help you when they feel like they're being attacked. So I think you have to really find ways to communicate, especially be mindful of your communication, and to verbalize to each other maybe what you miss about how your relationship was. If you're not finding as much quality time for each other, saying, I miss us being able to go out and have date night. I miss us being able to be more intimate with each other. You need to have these open conversations and not be embarrassed about it. And your partner is going to be so appreciative that you miss that time with them, that you miss the connection, because it is disrupted when you have a new baby. But like we've been talking about, that time is temporary. It's a season, but it does put a strain on the marriage. And I think there are just some years of the marriage that are going to be challenging. And I think that postpartum period is one of the most difficult on a marriage. So don't neglect it. Don't put it on the back burner. Try to keep it strong.
We've almost come to the end of the show, but I just wanted to come to both of you and just ask you for your last words of advice for new mothers.
I think you have to give yourself permission to have moments in your life, especially as a new mom, where you don't feel strong. You don't have to feel strong all the time in your life. Sometimes strength is letting your tears fall. It's asking others for help. It's being self-aware of when you've reached your limits. And just because maybe you might look at another mother who seems to be doing it all, doesn't mean she also doesn't have her limits. So be kind to yourself. Don't compare yourself to other women, to other families, to other mothers. We all have different capacities. Focus on your journey, focus on yourself and your needs, and reach out. Okay. Don't be afraid to reach out for support. Dr. Laela, who we've been honored to have on the show today, she has an Instagram page where you can reach out to her for questions. And also there's an international helpline, the Postpartum Support International Helpline, which is the number is 1-800-944-4773, that you can reach out to for questions as well.
And Dr. Laela, if you let us know what your handle is for our viewers so they can follow you, and if you can give us your final words of advice.
Sure, definitely. So, again, to echo a lot of the things we said, my big thing is at the end of the day, when we're talking about the mental health of a mom, healthy mother equals a healthy baby and a healthy family, right? And that's my mantra. Whenever things may change, your birth plan didn't, leads to cesarean. That's okay. At the end of the day, you're healthy, right? And your health is utmost importance, because then that reflects in your ability to have a healthy baby, okay? So healthy mom, healthy baby as your mantra. Build your village. Your village may change, and setting those healthy boundaries, because again, at the end of the day, you know your baby best, okay? And so not feeling those artificial pressures, doing your best not to, are kind of like those three concepts.
Thank you so much. Thank you, Sister Anisa, and thank you, Dr. Laela, for a very interesting, insightful topic today, and for sharing with us your views and talking about some stuff that we probably don't talk about as a community. So thank you both.
Thank you.
Thank you.
And viewers, thank you so much for tuning in, and we'll see you again same time next week. Take care. Ma salama.